Good evening. I'm Sandy Harris, and this UTS Witness News. In headlines today, a breakthrough in medicine. Could this be a cure or just another market scheme? Men questioned in Wakers Hill over drug trafficking, and elderly men assaulted in the inner suburb of Liverpool while walking early in the morning. Stay tuned for the full story later this evening.
Good evening, I'm Natalie Claire and this is UTS Advanced Eyewitness News. Today's top stories: our most widely prescribed drugs since their introduction from the 1980s. How well do they work and are they really used for us, and what effects could they cause? We are joined live with Dr. Hass. Good evening, Dr. Hass. Thank you for joining us.
Good evening, Natalie. Thanks for having me.
These drugs that everyone's talking about, ACE inhibitors, can you give us some more of an insight about them?
Sure, Natalie. ACE inhibitors, or angiotensin converting enzyme inhibitors, are drugs used primarily for controlling hypertension, so for people who suffer from high blood pressure and congestive heart failure. These drugs are used in order to prevent strokes and to additionally prevent any kidney damage secondary to hypertension and diabetes. Many scientific studies have proved that individuals who are treated with these drugs do live longer lives than patients who have not taken the drug. Common examples used among individuals worldwide are lisinopril and ramipril, in comparison to one of the first drugs manufactured under the category of ACE inhibitors, also known as captopril.
This all sounds so good. Many people are interested to know, how do they work?
These drugs competitively inhibit the activity of ACE to prevent the formation of the active octopeptide angiotensin II from the inactive decapeptide angiotensin I. This occurs in the blood and tissues including kidney, heart, blood vessels, adrenal glands, and the brain. Angiotensin II is a vasoconstrictor that promotes aldosterone release, facilitates sympathetic activity, and has other potentially harmful effects on the cardiovascular system. Reduction in blood pressure secondary to vasodilation following ACE inhibition is greatest when the renin-angiotensin system is stimulated. This is in people who undergo diuretic therapy or people who suffer from renal artery stenosis. But ACE inhibitors also lower blood pressure when there is normal or low activity of the renin-angiotensin system. Inhibition of ACE also leads to the accumulation of kinins. The most popular one is the bradykinin, which promotes vasodilation activity and may contribute to the overall effectiveness of ACE inhibitors. So what I'm trying to say, in summary, these drugs cause relaxation of blood vessels as well as a decreased blood volume, which leads to lower blood pressure and decreased oxygen demand from the heart. They inhibit the angiotensin converting enzyme, which is an important component of the renin-angiotensin aldosterone system.
Wow, this sounds really great. Many women that may not be aware about these drugs would like to know if they would have any effect during pregnancy.
That's right. A lot of people are not aware that these are prescribed drugs, so if you're pregnant, your doctor shouldn't prescribe you with these types of medication. So if your doctor is prescribing you this during pregnancy, then we do have an issue on our hands. No, but with all seriousness, these can potentially be harmful to the baby as it can cause fetal toxicity, which is fatal.
We definitely don't want that happening. Also, Dr. Hass, people of Australia want to know if there are risks in taking these, or would they simply benefit them?
Well, yes, of course. For everything comes advantages and disadvantages. For instance, ACE inhibitors have revealed to increase nitric oxide concentration in addition to increasing bradykinin levels. This is shown to lead to improvement in endothelial function. But let's talk about the clinical level, the benefits. The benefits are basically that if you look across the cardiovascular spectrum, if you look at diseases such as coronary artery disease, congestive heart failure, stroke, and renal dysfunction, all across the vascular spectrum of risk, ACE inhibitors have been shown to reduce all-cause mortality, reduce hospitalization rate, and improve quality of life and symptoms for the patients. So yes, with benefits, there are many. However, these drugs are not without their side effects. The side effects could be grouped into those that are related to higher bradykinin levels, which is mainly cough and angioedema. Angioedema is rare, but cough is present in approximately 20 to 25% of patients who take the drugs. In those particular patients, angiotensin receptor blockers may be fairly beneficial. The additional side effects as a result of the decreased blood pressure may cause the patient to feel dizzy. But a major concern among people is the deteriorating function of the kidney. Now we have to remember that ACE inhibitors related to worsening renal function is primarily a function of renal physiology, and it does not necessarily represent a poor kidney function per se. Most of the patients, if they do not have renal artery stenosis and they are not dehydrated, a little increase in creatine does not mean that we need to cut back on the ACE inhibitor dosage or stop these medications altogether, because in the long-term run, these drugs are really beneficial. So when it comes down to renal dysfunction, if someone's creatine level goes up significantly, I think it is most suitable to rule out renal artery stenosis, and we have to make sure that the patient is not dehydrated or has decreased their dose of diuretics or anything like that. But most of their time, there should not be a reason to stop the ACE inhibitors therapy.
This all sounds very interesting. I hope many people are more aware about these drugs. Well, Doctor, it's been a pleasure having you tonight.
Thanks for having me.
Stay tuned for the late night news with Mark Roberts. I'm Natalie Claire, and this is UTS Advanced Eyewitness News. Good night.